Welcome. Welcome. Thank you for coming to Hudson Valley ADL Center. My name is Jennifer. This is a part of Patient Education Series. Today's seminar on arthritis of hand and shoulder will take about 20 minutes. Please make sure that you have a notepad and pen to take notes. Write questions. Let us go through the agenda. We start with facts about arthritis, define it, and detail hand anatomy. We will follow up with common types of arthritis with symptoms, causes, diagnosis and medical treatment for each. We will concentrate in more details and talk about pain management and how exercises, joint protection and therapeutic aids, splints and modalities will help you. We will discuss unproven remedies. Finally, we will do a quick Mayo Clinic arthritis quiz. So please relax and enjoy the presentation. Let's review some facts about arthritis. According to Center for Disease Control, arthritis is one of the most prevalent chronic health problems and leading cause of disability among Americans over the age of 15. As a condition, it was ranked ahead of blood pressure, lung, heart and spine troubles. Almost 100% of the population is susceptible to some form of arthritis, and if an individual lives long enough, he is almost certain to develop one type or another. Arthritis results in more than 39 million physician visits and more than 500,000 hospitalizations each year. Although arthritis is a crippling disease, it seldom kills. No other group of diseases causes so much suffering to so many people for such long periods. Arthritis strikes women more often than men. Arthritis refers to more than 100 different diseases that affect areas in or around joints. According to Centers for Disease Control, physical activity can have an important and beneficial effect on arthritis pain and associated disability. Most of the time you can take charge of this disease by controlling pain and exercising away your stiffness. What is arthritis? First part of arthritis is a Greek word arthros, meaning joint. The second part, itis, meaning inflammation. Arthritis is inflammation of a joint. We will spend a few minutes learning about joints. Joints are the areas where two or more bones meet. Joints consist of cartilage, a connective tissue that covers bones and is made up of cells and fibers and is wear resistant. Cartilage helps reduce the friction of movement. Synovial membrane, a tissue that lines the joint and seals it into a joint capsule. The synovial membrane secretes synovial fluid around the joint to lubricate it. Ligaments are tough, elastic bands of connective tissue that surround the joint to give support and limit the joint's movement. Tendons, another type of connective tissue on each side of a joint attached to muscles that control movement of the joint. Burses, fluid-filled sacs between bones, ligaments, or other adjacent structures help cushion the friction in a joint. Synovial fluid, a clear, sticky fluid secreted by the synovial membrane. There are many types of joints such as ball and socket joints of the shoulder that allows backward, forward, sideways for rotating movements. Hinge joints of the fingers and elbows allow only bending and straightening movements. Ellipsoidal joints of the wrist allow all types of movement except pivotal movements. We will review the bones in your hand. The 5 bones of the hand are called the metacarpal bones. These are the long bones that lie within the palm of the hand. The metacarpals attach to the phalanges, which are the bones in the fingers and thumb, 3 in each finger and 2 in the thumb. The wrist itself contains 8 small bones, called carpal bones. These bones are grouped in 2 rows across the wrist. The proximal row of carpal bones connects the 2 bones of the forearm, the radius and the ulna, to the bones of the hand. Nerves. All of the nerves that travel to the hand cross the wrist. 3 main nerves begin together at the shoulder: the radial nerve, the median nerve, and the ulnar nerve. These nerves carry signals from the brain to the muscles that move the arm, hand, fingers, and thumb. The nerves also carry signals back to the brain about sensations such as touch, pain, and temperature. As I had said earlier, there are over 100 diseases classified as arthritis. Some of the common types are osteoarthritis, rheumatoid arthritis, psoriatic arthritis, fibromyalgia, Lyme disease, lupus, scleroderma, gout. In this seminar, however, we will restrict ourselves to osteo and rheumatoid arthritis. Osteoarthritis or degenerative joint disease. It results from breakdown of cartilage in joints, leading to pain and damage. This is the most prevalent form of arthritis. The most commonly affected are the end joints of the fingers, the base of the thumb and the hip, and the joints of the lower back. Almost 85% of all people over 75 show evidence of this condition. In people less than 45 years old, the prevalence is greater in men than in women. In the older age groups, a larger proportion of women suffer from the disease. The incidence of osteoarthritis is not affected by race, geographic location, income, or education. Possible causes of osteoarthritis. This is known as the wear and tear type of arthritis. Risk factors include obesity, repetitive stress on a joint, trauma to a joint, and congenital abnormalities. There is a possible genetic predisposition for osteoarthritis. These plates show hands symptomatic of osteoarthritis. How is osteoarthritis diagnosed? Medical history and a physical exam by physician and X-rays can be helpful in evaluating osteoarthritis. Blood tests should be normal in osteoarthritis but may be ordered to rule out other types of arthritis. In Figure 1 is a normal knee, and Figure 2 the joint space is narrows and there is bone spur. In this plate you can see narrowing of joint space in the carpal metacarpal joint. Treatment of osteoarthritis. Drug therapy is used to control discomfort. The most familiar acetaminophen products, Excedrin and Tylenol, may be suggested. If inflammation is present, a non-steroid, anti-inflammatory drug such as aspirin may be prescribed. However, exercise and joint protection is very important. This service provided by a qualified therapist will be discussed in this presentation. If your physician recommends surgery, or has recommended surgery, you to our website www.adlcenter.com to review an animated presentation or provide you with a printed brochure on arthritis-related surgical procedures such as basal joint, finger fusion surgery, wrist fusion, interposition arthroplasty of the elbow, shoulder replacement, resurfacing and reverse shoulder replacement. In the descriptions you will find information on post-surgical rehabilitation. Rheumatoid arthritis. Instead of attacking the cartilage, as osteoarthritis does, rheumatoid arthritis causes inflammation of the synovial membranes of joints and tendon sheaths. You will recall it is a tissue that lines the joint and seals it into a joint capsule. The synovial membrane secretes synovial fluid, a clear, sticky fluid around the joint to lubricate it. Rheumatoid arthritis afflicts the small joints of the hands and joints of wrists, elbows, and shoulders. It is estimated that 3% of the population is afflicted with rheumatoid arthritis. It is the greatest crippler from the standpoint of severity and prolonged disability. Rheumatoid arthritis may occur slowly and involve only one joint and then progress to involve other joints. Or it may come on suddenly and involve many joints all at once. Joint inflammation may be accompanied by fever, weight loss, fatigue. People with rheumatoid arthritis may present with rheumatoid nodules, which are inflamed knots or bumps that appear over pressure areas such as the elbow. Another common deformity of the hands is known as ulnar drift. Causes of rheumatoid arthritis. Researchers suspect that one or more infectious agents trigger an autoimmune response. The immune system in susceptible people cannot completely get rid of this infectious agent and it begins to attack the synovium of the joints. Once that occurs, inflammatory cells stay turned on, causing the inflammation to continue. Researchers also believe that genetics play at least some role in the development of the disease. There is a genetic marker LADR4 which has been found to be linked to rheumatoid arthritis. How is rheumatoid arthritis diagnosed? Medical history and a physical exam by physician is used to diagnose rheumatoid arthritis. In laboratory tests, someone with RA may have an antibody in their blood called rheumatoid factor. If red blood cell count is low, a platelet count, to measure the number of cells in the blood that help it to clot, may be ordered. Another test that your doctor may order determines your erythrocyte sedimentation rate, ESR, or SED rate. Although these blood tests can be helpful in making a diagnosis, there is no single blood test that can establish or rule out the diagnosis of rheumatoid arthritis. Early in the course of rheumatoid arthritis, there may be no abnormalities detected in the blood or on joint X-rays. Your physician first may likely treat you with a non-steroid anti-inflammatory such as aspirin. He may also suggest anti-rheumatic drug with claims of disease modification. There are biologic response modifiers. These are beyond the scope of this presentation. However, exercise and joint protection is as important and will be discussed. If your physician recommends surgery or has recommended surgery, I can direct you to our website to review an animated presentation or provide you with a printed brochure on arthritis-related surgical procedure. In the descriptions you will also find post-surgical rehabilitation which a therapist provides. In short, damage to joint cartilage, inflammation of joint lining, and strain on muscles can all be mitigated to some extent by a customized therapy program. The program will help in performance of activities of a daily living but will not cure the disease. For severe stress management, a psychotherapy session may be pertinent. In the meantime, let us take a few minutes break to exercise our joints.